Understanding Ewing sarcoma. Causes, signs, symptoms, and treatment. Ewing sarcoma is a rare, aggressive cancer that primarily affects the bones or the soft tissue around the bones. It predominantly occurs in children, adolescents, and young adults, typically between the ages of 10 and 20. The disease is named after Dr. James Ewing, who first described it in the 1920s. Here's a detailed overview of its causes, signs, symptoms, and treatment options. Causes. 1. Genetic mutations. Ewing sarcoma is primarily caused by genetic mutations involving translocations between chromosomes 11 and 22, resulting in the EWSR1-FLI1 fusion gene. This fusion gene plays a crucial role in the uncontrolled growth of cells. 2. Not inherited. Unlike some cancers, Ewing sarcoma is not inherited and does not run in families. 3. Unknown risk factors. The exact cause of these chromosomal changes is unclear, and there are no well-established environmental or lifestyle risk factors. Signs and symptoms. 1. Pain. Persistent pain at the tumor site is the most common symptom, often worsening at night or with physical activity. 2. Swelling. Swelling or a palpable lump in the affected area, which may be warm to the touch. 3. Fever. Unexplained fever, which may come and go. 4. Fatigue. General tiredness and fatigue. 5. Weight loss. Unintended weight loss and loss of appetite. 6. Reduced mobility. Difficulty moving the affected limb if the tumor is located near a joint. 7. Fractures. In some cases, the weakened bone may break with minimal or no trauma. 8. Neurological symptoms. If the tumor compresses nerves, symptoms like numbness, tingling, or paralysis may occur. Diagnosis. 1. Physical examination. Initial assessment includes a physical exam and medical history review. 2. Imaging tests, X-rays, to detect abnormalities in bones. MRI, CT scans. Detailed imaging to determine the extent of the tumor and its relationship to surrounding tissues. Bone scan, PET scan, to check for metastasis, spread of the cancer. 3. Biopsy. A sample of the tumor tissue is taken and analyzed to confirm the diagnosis and identify the specific genetic mutation. 4. Blood tests, to assess overall health and detect any abnormalities. Treatment. 1. Chemotherapy. Primary treatment. Chemotherapy is often the first line of treatment to shrink the tumor and address micrometastasis, small, undetectable spread of cancer. Drugs used. Commonly used drugs include vincristine, doxorubicin, cyclophosphamide, ifosfamide, and etoposide. 2. Surgery. Tumor removal. Surgical removal of the tumor is performed if feasible, aiming to achieve clear margins, no remaining cancer cells. Limb-sparing surgery. When possible, surgeons aim to preserve the limb and its function. Amputation. In cases where limb-sparing surgery is not possible, amputation may be necessary. 3. Radiation therapy. Local control. Radiation may be used to target remaining cancer cells in the tumor site, especially if surgery is not an option. Palliative care. To relieve symptoms in cases where the cancer cannot be entirely removed. 4. Targeted therapy. Emerging treatments. Research is ongoing into targeted therapies that attack specific genetic mutations involved in Ewing sarcoma. 5. Clinical trials. Innovative approaches. Participation in clinical trials can provide access to new and potentially more effective treatments. 6. Rehabilitation. Physical therapy, to restore function and mobility, especially after surgery. Psychological support. Counseling and support groups to address the emotional impact of the disease and treatment. Prognosis. Factors influencing prognosis. The prognosis depends on factors such as the tumor's size, location, stage at diagnosis, and the patient's age and overall health. Survival rates. Advances in treatment have improved the prognosis for Ewing sarcoma, with about 70% survival rate for localized tumors, but the survival rate drops significantly if the cancer has metastasized. Follow-up care. 1. Regular monitoring. Ongoing follow-up is crucial to monitor for recurrence and manage long-term side effects of treatment. 2. Survivorship care. Comprehensive care to address physical, psychological, and social challenges post-treatment.